Hey, Rukia, can you give me video access, please?
Hi, yes, should be good. There you go. Also just a heads up, from this meeting and on, Adrian will just be joining as an attendee.
Did you already have the handoff from her?
Yes, we had a Zoom call yesterday and today, and then I'll start doing those duties once I have a contract with PHAP.
Okay, perfect. Sounds good. And you turn in all the paperwork for that?
Yes, I did yesterday. So hoping to hear back early next week, possibly.
Okay, sounds good. And good afternoon, Brian. Good afternoon, Yosh. Hope you guys are doing well and things are slowing down a little bit for you guys, if at all, in the new year. I guess it's 4:30. I will wait a couple minutes to see if anybody else will pop in. If not, this might be a very fast HiPAM meeting, and I'm sure no one's going to complain too much. Aloha, Francis. Thanks for coming. Good afternoon, everyone. Looks like we have a very tight-knit crowd today. I know that things are ramping up for everybody. Work, COVID is not to say taking a backseat, but everybody's getting in the rhythm of hopefully some sort of new normal, which is good. But once again, we're here to provide updates, anything that may be of interest, not just on a local level, but also at a national, international level, when it's applicable, and for us to tie in. So we're going to go ahead and get started. We'll, depending on how many people show up, I may choose to keep this brief, or if there's some really specific questions, we may just kind of keep this more informal, since it's been a while since we've had this small, tight-knit attendance. So Japan, thankfully, is trending down, and the WHO put out a statement earlier this week saying globally trends are also decreasing. So once again, that's a good sign. However, on the variant front, that continues to be something of extreme interest to everybody, as that may impact future transmission of cases globally. At a national level, it is clear that we are on a downward trajectory, with consistent downward trajectory, which is great news. As we have passed the holidays, and hopefully as we have some firm guidance from the new administration, which I'll talk about for a deep dive, it should provide some stability to a national response, which would have some strong impacts and ripple effects to all the state responses to COVID and the COVID vaccine. Arizona and California, once again, trending in the right direction. Arizona seems to be plateauing just a little bit, but California does continue to be trending down, even though we do continue to see reports of some of the new variants within California. Nevada and Texas also tend to be trending down. We'll still keep an eye on Texas, but once again, really great news for us, as we still see majority of our tourists, our national tourists and our returning residents come from these four states. And as of 26 January, which is 2 days ago, in order to re-enter the United States from anywhere outside the country, you have to have a PCR or an antigen test sent to us prior, but that's obviously pending whichever state you're flying into or territory. Looking at our Hawaii specific overview, better, continuing to trend in the right direction. Now Maui County is the only county that has cases over that 10 case per 100,000 mark. Kauai tends to be is the only one that's in that green zone. However, we are trending in the right direction. Our percent positivity as a state is below 3%. As a county, for Honolulu County is right at 3%. But once again, a big improvement from the December and early January time frame, when we were close to 5%, more at 4.5%. DOH just, this is a new slide that I just added in a few minutes ago because I saw this afternoon. Our partners at Disease Outbreak Control Division within DOH added this additional tidbit to their dashboard, which shows now a daily update to COVID-19 vaccine doses administered. And the great thing is now you can see a change per day. And you can see where we are now, over 127,000 doses administered, and that's up about 7,000. So you can start to see and plot daily vaccine administration rates. And then we still have our weekly summary to see how we're trending. And I believe last week we were only about 45% of doses administered. Now we're up to 62%. As the state and the counties refine their distribution and their administration models. And we've had 203,000 doses allocated. We received 170,000, of which 106,000. And if you've been paying attention to the news, you can see that Hawaii does sit a little behind the power curve, solely because of where we're located, and with the way the logistics plays out. We're behind the power curve a little bit, just out of no fault of the states. So once again, we do catch up, and we do, I think, vaccinate as much as we can with the time frame that we're allocated from the federal side. Testing turnaround time seems to be great, and that's consistent with the trend that we've had. And we're sitting at about 100. Today was I think 100 cases, and so this is a big part in our mitigation strategy. Looking at HiPAM's forecast for the next 14 days, consistent with what we've seen the past 10 to 12 days, we are forecasting a relatively stable trend, slight increase, but once again, nothing crazy is expected, taking into account where all the thing, our vaccination efforts. Travel has now come back down in terms of levels pre-holidays, and we understand that holiday travel did contribute to quite a bit of the surge, and then as a result, the community spread. So with that, with us being past that that holiday travel, and with rates returning to what they used to be in the November and the October months, we feel comfortable with this forecast, and with the great work so far at DOH. They have identified one of the variants found in California, and we will continue to monitor that. But as of now, it doesn't appear to have taken a massive hold in the state in terms of transmission. And then as a result of this very flat case projection, you see subsequent similar projections for hospitalizations, deaths, and ICUs. You can see a very small increase in the pessimistic and the expected as well. Let me see, there are no questions. And looking at our participants, you guys are all battle veterans of HiPAM and COVID. So once again, thank you for your participation. Calling out Cody for joining. Thanks for joining us. As always, you guys know the drill. If you have questions for anything that I'm bringing up, and I have the pleasure of briefing the deeper dive today, just throw it up in the Q&A or raise your hand. A couple of science highlights. Obviously, there's more. And I think with today, we have some time to address others if you want to pop them in the Q&A. Some two that are important, both for the clinical and the public health side, that I wanted to touch upon. One is from the CDC, the other one is from JAMA. So the CDC literally, yesterday changed, at least from the last I saw, they updated their recommendations in terms of interchangeability of vaccine products. And I know we have Dr. Wu on, and I'd love to get your take on this as a clinician. And I know Janet can't make it today, but previously CDC was recommending flat out that you could not interchange COVID or the Pfizer and Moderna vaccines between first and second dose. While they still very firmly recommend not to do that, they have now updated their language to reflect, and I quote, in exceptional situations in which the first dose vaccine product cannot be determined or is no longer available, any available mRNA COVID-19 vaccine may be administered at a minimum interval of 28 days between doses to complete the mRNA COVID-19 vaccine series. I'm guessing 28 days is because that's the interval for Moderna, whereas the interval for Pfizer is 21. But once again, this is the first that we've seen from the CDC that now there is language that supports interchangeability of vaccines, and I'd love to get some perspective from clinicians. And also, I see Tom and some of our modelers on here. this may impact future, vaccine and maybe modeling, but with the Johnson & Johnson and the Novavax vaccines on the horizon, I don't foresee, knock on wood, us having to deal with some of these vaccine shortages in the next 3 to 6 months. And then as we start to do more in-depth after action reports, and we start to figure out what we did, where we can improve for a future pandemic response, there was a research letter submitted and published in JAMA that looked at some survey data from April to November, end of November, and they completed a survey every 14 days, and they tried to kind of create an index on people following non-pharmaceutical interventions such as mask wearing, physical distancing, not holding parties and gatherings, etc. Scores range from 0 to 100, with higher scores indicating better compliance. And so what I found interesting was there was peak compliance in April, obviously, as that was the right when everybody was, at least in the United States, really on edge. We didn't know what to do, so every precaution was taken. It dropped to about 50. That index dropped to about 50 in June, with being midsummer and people kind of wanting to experience summer. And then by the time the survey ended, it increased a little bit to 60. Well, but once again, this is for all of the questions that were surveyed. Some call outs from this from the results. It's interesting to know that at the end of the study, compliance or to non-pharmaceutical interventions was significantly lower in the Midwest compared with the Southwest and the Northeast. And if you correlate this finding with what we saw in the epi curves at that time nationally, it makes sense, because that's when we saw the biggest surges in the Midwest, in the rural towns, because that was the middle of that second or third surge for our country, whereas for that first surge it was mainly New York and the coastal states that dealt with the brunt of that. So once again, correlation doesn't equal causation, but it's interesting to look at some of the social behavioral results and try to correlate that and see if there's any associations with what we saw on the epi side, on the stat side. Other interesting notes for all of us in terms of public health messaging side: largest decline were in two of the categories. First one was in having no close contacts outside their households. That dropped from 63% in April to 37% in November. And then refraining from having visitors in their home dropped from 80% to 57.6%. So and that refers to compliance, not percent of people doing it. So obviously that contributed to increased transmission. One positive note is that by the end of this study in November, mask wearing compliance increased from 40% and a little more than double, to 88%. So that's possibly attributed to just better messaging. So that's encouraging, as it seems as if even with vaccines, mask wearing will be vital. And there's the past week or so there's a lot more visibility on double masking as protections against these new variants. So two science highlights I wanted to bring to the attention of everybody here. And then if you all watch this recording later on, I will pause a few seconds for anybody to raise their hand or to type in anything in the Q&A chat. And if not, then I will move on in a little bit. Okay, hearing none. We've had so many great speakers and topics for for our deeper dive. Since we've started this in October, it feels like we've been doing this, for years, but we really started this webinar format in mid-October, and we've had really good topics stemming from the variants to more of the modeling aspects. And Josh presented on Doc D's perspectives, and hopefully we'll have another presentation in a couple weeks from Josh and Doc D. But today I wanted to kind of step back a little bit. I think rightfully so, we spend so much time on how COVID impacts Hawaii, and as we should. This is HiPAM, Hawaii Pandemic Applied Modeling Group. But what needs to be brought up is that previously we were dealing at a national level without a formalized strategy or plan, and as a result, the state had to take it upon themselves to develop their state specific plans. And now with this new administration, within I think the first day or two, President Biden released his administration strategy for the COVID-19 response and pandemic preparedness. And so I read this a couple of times. It's a 200-page document. I definitely missed it, but the link is here for you to peruse at your leisure. It's high level, but it really provides perspectives and what to expect, especially at the state level, in how the coordination will move forward. And then obviously there's going to be secondary and tertiary impacts to everybody working in this area, currently in the future in the state, whether or not you're a state employee or a partner of the state So I wanted to spend a little bit of time today just going over it. And I encourage you to share this with everybody, as this will really drive the response nationally and locally for the near and the midterm. So there are 7 goals for this particular strategy. You can read them here. I'm going to go over them more in detail. I'm not going to read through the slide right now. But the bottom line up front, there are 7 goals. First one is to restore the trust with the American people, and that's at multiple fronts. Locally, we all have experienced difficulties with trying to educate and to help our fellow Hawaii citizens understand the severity and the scope and the impact of COVID. And so a lot of that, moving forward, we have to restore trust locally, and then obviously at a national level, to try to keep the politics out of it. So goal 1 is to restore the trust. So from a public health messaging standpoint, clear lines of communication from the federal all the way to the local levels. And then first is to conduct regular expert-led science-based public briefings. And yesterday, there was a town hall that CNN hosted with President Biden's COVID-19 team. I missed it, but there are some good tidbits. And they're being honest. They weren't sugarcoating the short-term expectations. But once again, honesty is the first step to building trust. Francis, question for medical providers. There are non-medical N95 masks available at Amazon, about $1 each. But the recommendation is still for the general public not to use N95 masks. Comments. Francis, I'm gonna remind me if I don't answer this, but I will hold this until the end. I know we have Dr. Wu on, and if anybody else wants to take a stab, definitely. But we will get to that question, and we'll have plenty of time for that. So Francis, please hold me to that if I don't circle back to it. As everybody is participating in this call, data, we are all big cheerleaders and lovers of data. And another part of goal 1 is to publicly share data around key response indicators. And while they didn't go into specifically what those indicators are, it's good to know that there will be increased transparency of data sharing and data collection. And once again, to engage the American people, to once again, to not to belabor the point, but anybody who works in education or public health education understands that it's a two-way street. We can't just be telling people what they should do. We need to understand what they're currently doing, why they might not listen to what we're recommending, and to have that dialogue, especially in our vulnerable communities. So once again, this is a big part of goal 1. Science first public health campaigns, not going to go too much more because this is preaching to the choir, but returning to data-driven and science-backed messaging. Goal 2, mount a safe, effective, comprehensive vaccination campaign. And obviously the past month or two has been really focused on vaccine efforts locally. And there have been documented hurdles that have stymied the local response because of some of the difficulties at a national level. But once again, it's good to see that the second goal is to work on improving the vaccination campaign. First steps, expanding vaccination manufacturing and purchasing. I think yesterday or 2 days ago, we repurchased additional Moderna and Pfizer allotments. So that's going to increase the speed with which we can disseminate vaccinations. Create many venues as needed for people to be vaccinated. I've heard, at least locally, there are potentials to increase vaccination sites, and obviously at a national level. Thanks, Tom, for stopping by. At a national level, there have been a lot of, and I can speak from where I sit right now with the DoD. We are working really hard to support the 100 million, now 150 million shots in 100 days, and there is a big push to incorporate state and federal responses to work together to really focus on hard to reach and high risk populations, and obviously compensation for providers and state and local governments. Driving equity through vaccine campaign and broader pandemic response, and then to have a truly national vaccination public education campaign. So I think before it was kind of scattered, but now it's going to be cohesive and unified. So and once again, tie into goal 1, bolster data systems. So I just went to CDC, and I think they've also improved their website and data dissemination, so you can start to see better granularity in terms of doses distributed, administered, first dose and then second dose, and then now by vaccine type. And I'm sure that what we're getting and what our partners at DOH are collecting are also feeding into what the CDC is making available at a national level. Vaccine safety and efficacy. There has been so much, both positive and negative within this specific subtopic of vaccination. So once again, the more data we can collect, the better we can message and educate the public. And then surge the healthcare workforce. Not going to spend too much time. I just want to kind of hit the major points. Goal 3, mitigate spread. Once again, doing the 3 W's, the easy things: masking, washing your hands, testing. Oh, apologies for the type of treatment. Data, workforce, and clear public health standards. Once again, previously, if you remember, there was not a standardized, or there was no federal guideline in terms of what to do when you're traveling, if there needs to be a mask wearing or not. So I think last week, now on all federal properties, travel on major airlines, commercial aircraft, trains, public maritime vessels, and all forms of public transportation, you have to wear a mask. And then working with governors and mayors to continue to emphasize mask wearing. Testing has always been an issue from, if you can remember, back in April and May of last year at a national level. So continue to ramp that up. And then prioritization of therapeutics backed in science. In Hawaii, we often deal with some limitations with personnel, especially in our public health working space. So to expand the U.S. public health workforce, and hopefully that will trickle down to Hawaii. I bolded in goal 3, improve data to guide the response. Once again, HiPAM really focusing on data. So I'm glad we're to see this emphasized multiple times throughout the strategy. So this one doesn't pertain so much to HiPAM, but this what we do with the vaccine efforts and also the COVID response does tie into logistics, and so to immediately expand emergency relief, and to also utilize the Defense Production Act, which will impact PPE testing and also vaccination supplies. We've been hearing reports that a big limiting factor in the beginning for vaccine distribution is not so much the vaccine itself, but the vials, the glass that's used, the rubber, some of the syringes. So things that we normally don't think about, but now with the activation of the DPA, the Defense Production Act, we won't have to deal with some of those logistical hurdles. Goal 5, once again, a lot has been made, and rightfully so, about schools, how to reopen schools, and then in Hawaii, businesses and tourism, while protecting workers and everybody living on the state. So once again, we should be expecting a national strategy to safely reopen schools with the goal of getting a majority of K-8 schools safely open in 100 days. And I know a lot of us, that there's so many impacts to that. And then higher education is once again big, and seeing how we can bring back our students to in-person learning, and then continue to provide guidance for businesses. So promote safe travel. We talked about this last week, but earlier this hour. So CDC, we need to have a 72-hour test now, no matter what state you're coming into, antigen or PCR. And then yesterday, Reuters and a few other major news networks broke the news that the U.S. is potentially looking at mandating COVID-19 testing for domestic air travel as well. So, Hawaii, we've kind of set the standard and set the bar for how to handle that, but it's interesting to see how the continental United States looks to handle this moving forward. And then I found that for this tying to safe travel, this morning, Dr. Fauci mentioned that getting vaccinated is not a free pass to travel, even though some of our local leaders have suggested that maybe proof of vaccination is maybe used in the future in lieu of a test. So, I think we should do all we can to mitigate travel and not just to use vaccine as a panacea, which we know it's not to be. Goals 6 of 7, protect those most at risk and advance equity, including across racial, ethnic, and rural urban lines. All 3 of those pertain very strongly to Hawaii. So glad to see that, establishing a health equity task force. And then once again, big bolded, increased data collection and reported for high risk groups. So once again, happy to see strong emphasis on data collection and data reporting to drive decisions for response. And finally, goal 7, while this may seem like it doesn't have much to do with us because it's more on a international level, it does for 2 reasons. So I'll read it. Restore U.S. leadership globally and build better preparedness for future threats. So, working once again with the WHO, restore the U.S. leadership to international COVID-19 response and advance global health security and diplomacy. So if you think about where we are, Hawaii specifically, in the Pacific, we are in the center between Asia and the U.S. And we have not even from a strategic level, but just from a business and travel, tourism and education perspective, we have so many nodes and reaches to Asia, Southeast Asia, the Pacific, Oceania. So once again, we are like the first stepping stone into the United States. And if there's another outbreak, hopefully not, of COVID or some other pathogen, Hawaii typically will see it sooner than the continent of the United States. So this is important for Hawaii. And then for HiPAM specifically, there's a key point within Goal 7, which is to build better biopreparedness and expand resilience for biological threats. So really focusing on establishing and integrating the National Center for Epidemic Forecasting and Outbreak Analytics. So what we've done within HiPAM and working with our partners in DOH and others to really stand up, in April, what we have today with forecasting, modeling, and working with our partners. I think this is huge that now we're seeing this being supported at a national level, and hopefully we can work with bring what we're doing to the forefront and partner with this hopefully new national center for epidemic forecasting. So there's some hope for the future that this space is only going to grow, and for students out there, and for our leaders and educators, to continue to turn our students towards the STEM. And once again, this is a perfect example of how it can directly impact what we're doing on the health and the research front. So what does this mean for Hawaii? I mentioned multiple connections throughout this, and I'd love to hear from the group here. But before we do that, Francis, I want to make sure we get to your question. We have about 25 minutes left, so plenty of time. Brian, Dr. Wu, do you have any thoughts from a clinician's perspective to Francis's question? I'll read it one more time. There are non-medical N95 masks available at Amazon for about $1 each, but the recommendation is still for the general public not to use N95 masks. So my first part is that still true? And if it is true, what do you recommend?
The mask thing is a bit complicated. The ones that you do find on Amazon or other places online, I think the general thought in terms of reliability of these masks are, beyond the N95s, which I think is still being recommended or not being recommended by the CDC just because of its need in the healthcare system. The KF94, the ones made in Korea, they probably are a bit more reliable in terms of the materials. You sometimes will have to be careful when shopping. There are some that said KF94, I don't know what word they use, or KF94 like, so it's not necessarily been vetted by the Korean standards, so always be careful for that. The K95, that's the one in China, so I think it's K95. Those are felt to have the most variability and reliability because of huge fluctuations in manufacturing standards. I don't know if that helped. And then there's a whole another discussion we could have about masks in general.
No, that's super helpful, Brian. And maybe we need to have that discussion with masks again, because as we're all human, we react to something and then we settle into a rhythm and kind of get complacent for lack of a better term. So maybe with these updates to the variants and maybe increased transmissibility, with the supply chain still being what it is, maybe we need to revisit what is, not just HiPAM, but from a state or national level, revisit what is best practices if you're not a clinician, regardless if you've gotten vaccinated or not. But that was very, very helpful, Brian. So thank you for that. Any other? Yeah, go ahead.
I just saw Francis' question. So to summarize, N95 best, but still should be used for healthcare workers. KF94 may be next, or potentially equal to surgical masks, but be cautious for surgical masks. And then after that would be, you've heard about the double layering of cloth masks as recommendations, but the setting that you're in also may dictate what type of mask you're wearing in terms of, are you indoors, closed environment, you might want a double mask compared to if you're just kind of going outdoors, kind of walking around thing. I hope that summary helped. Thanks.
Thanks, Brian. No, that really did. And I think, as with anything COVID, there's no black and white answer, unfortunately, which makes it a little difficult it makes it a little harder to educate and to get people to comply, just because it's so nuanced. But thank you. That was very helpful. Any thoughts or comments from our attendees in terms of questions that may have been brought up by the national strategy, or are we? I know even for me, I don't currently work for the state, so there may have already been direct impacts from the strategy. I'm not sure, but the good news is that there is something tangible that we can read to know that where the direction of the response is going to go at a national level, and we know that that's going to come down to a state level. And it's once again very positive to see data and data transparency and data decisions, science-backed decisions, multiple times throughout this 200-page document. So I'll pause for any questions or comments, and if not, this may be one of the rare times where we get off a little early, and I'm sure no one's going to complain about that. It's this is a marathon once again, and we always appreciate everybody's participation in the webinar. So I'll pause for a little bit before we close out for the day. Okay, seeing or hearing no hands or questions. Thank you everybody for attending. Next week, we're gonna have Tom present, Tom Blamey, one of our core HiPAM members. So excited for that. And in a couple weeks, tentatively, not to put Josh on the spot, but hoping to have Josh come back and talk a little more about Aloha Trace. So we have some great speakers lined up for the next couple weeks. So with that, have a great rest of your Thursday. Have a great, safe weekend, and we will see you next week. Thank you, everybody.